I'd like to introduce our speaker for this afternoon. Dr. Ayelet Spitzer completed her education at the New York Institute of Technology. She has a fellowship from Memorial Sloan Kettering Cancer Center in Hospice and Palliative Care Medicine. She did do an internship and residency at the Queens Hospital Center, and she's board certified in internal medicine. So without further delay, I'd like to introduce Dr. Spitzer.
Hi, thank you, everybody. Thank you for joining us this afternoon. I'm really looking forward to sharing this conversation, having this discussion with you. I just wanted to start by taking a minute. Harminder, it doesn't look like it is. There we go. Okay. So take a minute just to write down what's important to you. It could be anything. It could be your family. It could be, something you do. Just take a minute to write down what's important to you, most important to you at this time. And we'll just wait for a minute, give you that opportunity. If you're not going to write it down, you can think about it, but keep it in mind for this talk. Okay. Now that you've had a minute to do that, we're going to start with a poll. Do you have an advance directive? So you can see a poll has popped up. Some people don't know what an advance directive is. Okay, so you can see, can they see the results of the poll? Most people do not have an advance directive. We had 67% of people answer that they don't have an advance directive, and some people aren't sure, and that's fine. We're going to talk about what an advance directive is and how you get one and why it's important to get one today. Okay. So what is an advance directive? An advance directive is it's a legal document that can help ensure your preferences for various medical treatments. Those medical treatments would be followed, or your recommendations for the medical treatments would be followed if you're unable to make your own healthcare decisions. I think what a lot of people don't know about an advance directive is that you don't need an attorney to complete one. You can complete one wherever you are, whenever you want, with 2 witnesses or a notary, and you can really complete that without an attorney. The advance directive only goes into effect if your physician has evaluated you and determined that you cannot understand your diagnosis and treatment options and you cannot make medical decisions for yourself. That can apply acutely. So if you come to the hospital with a serious infection, or if you're having a surgery, or it can apply more chronically. For someone with dementia, they lose that ability to understand their diagnosis and their treatment options over time. The second point is an important one because I think a lot of people don't necessarily know that the advance directive stands only if you cannot make your own decisions. It does guide your decisions prior to getting to that point. You might say, I never want to be on a machine. I never want to be on a ventilator. But it only applies in the case where you cannot make your own decisions. It means that you, not your healthcare proxy, are in charge of your decisions if you're able to make them. Simply put, an advance directive is a set of instructions that a person can give to their loved ones to direct medical care in an emergency. So I put this comic in, take a minute to read it. I mean, what's important is really to have a conversation that's clear and concise and that really reflects what matters most. I think a lot of us, if asked, we would say that we don't want to be dependent on machines. But are there certain machines that are acceptable? Is getting dialysis acceptable? That's being dependent on a machine. The dialysis is done by filtering your blood through a machine. Is that something that's acceptable to you? Is a feeding tube acceptable? That's also the food is given through a machine often. Or maybe there are certain circumstances when a machine would be acceptable, maybe for a short period of time to support you through a severe lung infection, or if you had a surgery. We actually see advanced care planning take place over the course of several years and months. These conversations happen over time. It's not a checklist. You don't have a list that says, I want this machine and not this machine, and I want, this intervention, but these over here, I don't want. It's important, what's important to you might change over a few years or with a new diagnosis, and it's also impossible to predict what specific questions you might need to answer. What we do is when you're healthy, you start with specific goals. You complete a power of attorney that designates a specific person to make medical decisions for you. But we also talk about overall goals. Is it important to you to stay in your own home for as long as possible? Is it important to be independent for as long as possible? Those thoughts and those conversations can help build a general philosophy of care. So for example, if a person wants to remain in their home for as long as possible and they're faced with severe trauma or a neurological injury, as you can see as the example given on the slide, aggressive care might not be consistent with that goal of remaining home. That person would likely end up at a facility for the rest of their life. Next, you want to consider how things might change. So for example, someone with renal disease, dialysis may prolong your life, but you might lose some independence. Would that be acceptable to you to maintain a otherwise good quality of life? Advanced directives can change over time and as your health evolves. Finally, at the end of a prolonged illness, cancer, dialysis, renal failure, heart failure, you might want to change the focus of your medical treatment. Maybe you're no longer hoping for prolonging your life with chemotherapy or having cardiac procedures done, and instead you want to focus on your quality of life and symptom management. It's important to document these changes as well, and using a pulse to help the medical team guide medical decisions will be very important. I want to point out that these discussions, they don't have to occur in a vacuum. Involve your family, talk to your medical providers. Make sure you have a good idea of how your medical providers expect your disease to progress over time. So who can have an advance directive? Anyone over the age of 18 can have an advance directive. Anyone regardless of age or health should have a medical power of attorney, someone who they know makes medical decisions for them, including everyone really listening here today. So everybody should have these wishes documented somewhere. And like I said, your wishes at 18 are going to be different than your wishes at 35 and your wishes at 50 and your wishes at 70 or even 90. So they do change over time, and putting something down on paper isn't going to mean that that's what you choose for the rest of your life. So why? Why do we put these wishes down? It allows people to share their wishes with their loved ones. Make sure that your wishes are followed at the end of life. It also makes sure that people can think about what's important to them. Without taking the action to do it, you might not know exactly what you're looking for or what you want at the end of life. A lot of people worry that talking about death creates more worry. It puts you in a place where, we don't talk about that. You have a complex medical condition and you just don't want to think about what might happen, what negative things might happen. This is really a way to stay positive, and it's a way to make sure that you stay in control. It also helps patients avoid, and their families really, to avoid unnecessary or unwanted care. What I see a lot is that patients write these down or they have their attorney prepare an advance directive, and sometimes they don't know what it says in it. Sometimes they don't know the details, but more frequently is they don't share their wishes with their loved ones. And often these documents are stored in a location where it's very difficult to find. Maybe they're at the bank in a safety deposit box, or maybe they're at the lawyer's office or at the bottom of a drawer somewhere. And that creates a lot of stress for families when there's an emergency. A family member might not know that they're the one making medical decisions, or they might not know that they're doing right by the patient. They don't know that they're honoring what their loved one would want. And sometimes, unfortunately, you see that families can be divided. So instead of supporting each other in a time of need, they're fighting with each other. Staff also becomes distressed because sometimes they can be providing care that's harming a patient or causing unnecessary suffering. Okay, so now we're going to get to the meat of it, which is how do we even do this? I'm talking about why it's important. We're talking about what you might want to consider. How do we even do it? Now, I said that you don't need an attorney to complete this, and you don't. You may choose to, and that's also fine. But here are 3 documents that are easily accessible. These are New Jersey documents. So if you are in New York, you can either use these, but there are also documents for the state of New York, and these are honored across state lines. And there are 3 documents that we have here. There's the proxy directive all the way here on the left. There's the advanced directive for healthcare that talks about what your wishes are on the right. And then that green form in the middle is the New Jersey Pulse form that I did speak about briefly earlier in the talk. So the first thing we have here is the proxy directive. The healthcare proxy is a person who you appoint to make these medical decisions to honor your wishes. Most people choose a spouse or a child, but really it can be anyone over the age of 18. What's important isn't the person's relationship to you necessarily. It's really who is the most likely person to honor your wishes, to best honor your wishes. And a lot of people find that choosing a spouse is difficult for them because they feel their spouse might be too close to them, and they do choose someone else. So your healthcare representative is really the person who you feel is going to best honor your wishes. This can be anyone over the age of 18. And with this specific form, you can choose up to 3 people to serve as your healthcare proxies. This next form is the advanced directive. This is a living will. Those 2 terms are interchangeable. This, you're able to designate a healthcare proxy, but you also have this instruction directive in the middle of this first page over here. The instruction directive says that you realize there may come a time, like we said, when you are unable to make medical decisions for yourself. And at that time, this is what you wish for how you wish your medical care to go. And this form specifically directs you to check any interventions that you would not want. So if you don't check anything, then you would want all of these interventions. This includes CPR. It includes respiratory support, being connected to a ventilator. It includes food and nutrition, surgery, antibiotics, dialysis. But like we said, it's really not a checklist. There are some things that we can't possibly know are going to come up in conversation. So it's important, while this document is important, it's also important to have that general philosophy of care that your healthcare proxy is aware of. This form can be completed anywhere, at a doctor's office, in your home. What you need, you can see on the bottom over here, you can either have a notary sign this and stamp it, or you can have 2 witnesses over the age of 18 complete this for you. The one caveat I have here is the witnesses cannot be someone who is also your healthcare proxy. So that's just important to keep in mind. Lastly, we have the PULSE. The PULSE, the practitioner order for life-sustaining treatment. Sometimes we refer to it as the green form. It's green. It doesn't have to be green, but green makes it easier for us to find. This is an actionable order. The difference between this and an advanced directive is the advanced directive is a set of instructions, and the PULSE is an order that your medical team will follow. And this communicates the current plan of treatment, and it's honored by all healthcare professionals. In New York, they have the MOLST form, the medical orders for life-sustaining treatment. In New Jersey, it's called the PULSE. Different states call it different things, but it is honored whether from everywhere, from at a facility, a nursing home. EMS honors this form in the emergency room at various different hospitals, so it is transferable. This would be a form that travels with you when you go from facility to facility. We also have some information here. This is a tough conversation to have. What do you even start with? And the Conversation Project is a really great, it's a really great organization that helps people to have these conversations with their loved ones. What do you start with? I'm hoping that the link goes through. Are you able to see the link over here?
It doesn't seem to be popping up.
Okay. This is theconversationproject.org. When you, if you're able to, you can head over there, and hopefully we'll be able to send out some of these links as well. And if you do go to valleyhealth.com and search for advanced care planning, there's a lot of information there as well. And of course, we're able to answer any questions. You can find the palliative care department on valleyhealth.com as well. And you can always give us a call to help. Anyone in our department can help you with these conversations. And with that, any questions?
Hi, Dr. Spitzer, that was wonderful, very informative. There are a couple questions. I think you already answered what the difference between advanced care planning and POLST are, but does a person need both in New Jersey?
No, a person does not need both forms, and sometimes the two forms actually conflict with each other, which is why I said it's important to update it as your wishes as your wishes change. A POLST form is useful because we can act on it. It's something that if there's an emergency, sometimes we don't have access to the advanced directive, or we don't have access to the healthcare proxy. The POLST can be very helpful. But if your healthcare proxy understands your wishes, then an advanced directive, it's a set of instructions. We don't act on it, but it informs our decisions and our conversations.
Great, thank you. And is there a place I can retain independent professional medical designate services to assist, advocate, and represent me when I'm diminished or lose capacity?
That is a great question. I think what this person is asking is they're not looking for their family to make decisions. They're looking for someone else. There are independent case managers who can help you with this, and we're often contacted by these case managers to help guide a person's medical decisions. If you're looking specifically for a guardian or someone to make decisions, if you're not able to, I believe that goes through the courts. But you can always appoint a specific person prior to that.
Okay. And is there a form to request medical aid in dying?
Wow, that is a conversation for a different time. And the short answer is, in New Jersey, medical aid in dying is legal, but it's a process. There are many reasons why someone would choose it, but I think that's out of the purview of this conversation. I'm happy to, whoever asked that question, I can follow up, I guess, later, but there's no one specific form. It's a process.
Okay. And then what happens when multiple healthcare proxies differ on their wishes when I'm unable to make those decisions?
That's why it's important to make your wishes known. So they're not really making the decisions. They're more just implementing the decisions that you've already made. If there are two healthcare proxies who disagree, then we do our best to look at what the patient has said and what the patient has asked for, and try to make everybody aware of what those wishes are so we can do our best to honor them. But there can still be conflict even if we have these wishes written down.
Okay, and then how does the POLST transfer from hospital to hospital and state to state or between facilities and all of those?
Yeah, great question. It's because the POLST is a New Jersey form, it's valid wherever you go, but a facility has to know that you have a POLST. So it's important to have it either with you when you go to that facility, or if you are in the hospital and you have a POLST and you go to a nursing home or you go home and then go to a different hospital, it's important to present that to the new hospital when they go. It is not stored online, so it is a little bit difficult. I think New Jersey is moving towards having something like that. State to state is a little bit different because, like I said, New York has the MOLST form, and areas close to New York, close to New Jersey, they are familiar with the POLST form. That form itself does not travel from state to state. The advanced directive is honored, though, in a different state.
Great. And then I see one more question here. How valid are all three of these forms if a family member or the guardian contests? Is one more important than the other?
Also a very good question. The forms, as long as a person was of sound mind and you can show that they were of sound mind when they made the forms, then when they executed these forms, then they're valid. If someone contests that they were of sound mind, they can be invalidated by the court. I think that answered that question. Yes, they can be invalidated if a family member challenges a person's ability to make medical decisions at the time that they made the form.
Great. And then I think this is a question for me. Folks are asking if the program is being recorded and if it's going to be distributed later. Yes, the answer is yes, the program is being recorded. Either today or early tomorrow morning, everyone who is on this presentation right now will get an email from us. I'll try to include those conversation starter links that Dr. Spitzer had mentioned, and you'll also get you'll get notification of how to find the recording as well. So, and right now I don't think there's any other questions. So I want to thank you so much, Dr. Spitzer, for spending this time and on this really informative topic.